Wrenching to hear how hard they tried and couldn't get answers, and what the Murphys felt is something that Susan Racher and her son Matthew know all too well. It's because they have experienced it, and now they are helping families who are going through something similar. Thank you for being with us today.
Yeah, we want to thank you. In fact, Susan is the board president of NAMI Miami-Dade. Matthew is now a peer counselor. So Matthew, let's begin this story with you, because that's where it originates. Tell us about the dark path you went through, what triggered it, and how you clawed your way out of it.
Yeah, so I had a severe psychotic episode in 2011. I was experiencing delusions, thinking that I can control the weather, getting very paranoid, and experiencing symptoms of psychosis. My family took me to a local behavioral health hospital where I received care and treatment. And that was sort of my first glimpse into what's very important to me, which is peer support. People in the hospital setting were caring for me, helping me, peers, patients, walking me up and down the halls as I was frantic. And
you lost a close friend. Was that the beginning of it?
Yes, in 2010 I lost a close friend to suicide, and that propelled me into experiencing trauma leading up to the psychosis.
And while you're going through that, people often forget about what the families of loved ones are going through, and that's where your advocacy work began as a board member of NAMI. But you shared an interesting aspect of this with us before we got on television, and what you said was you had to learn to separate the person from the condition. And I think that's so important when we talk about mental health and mental health issues, that there is an individual out there, but this condition that they're experiencing makes them someone that they're really not to the family.
And the experience, yes, absolutely. The experience is terrifying for the family, and a serious mental illness is a situation that affects the whole family, the siblings, the parents, and the extended family. We're terrified when it happens because we didn't expect it. We didn't understand what it was.
Didn't want to believe it, did you?
Didn't want to believe it. Didn't understand what to do about it, and didn't know how to help our son. And living with that fear, coping with that guilt. What did we do wrong? What happened that caused this? There has to be a why, doesn't there? Well, in mental illness, there is no why. It happens. It happens to people Matthew's age, onset, and we just did a huge amount of work to find out how to help our son, found NAMI, and received support from its support groups.
What did doctors eventually diagnose you with?
So I was diagnosed with schizophrenia in 2011, and this was, the psychosis was a very isolating and terrifying experience, and then you receive a diagnosis that you're not sure what to do with it. You know, you hear all kinds of things about mental illness and severe mental illness, and that's when NAMI and my family helped out, and I have a very, my best friend as a peer support in my life, Carlos, who's helped me out a lot on my recovery journey. So,
in fact, you said seeing him was really key for you. You said, if he can do it, so can I.
Absolutely.
Absolutely, absolutely. I remember when I met my best friend Carlos, my mom had introduced me to him. He was working at a local restaurant, and for the first time I saw, here's an individual with shared lived experience who's going back to work, going back to school, pursuing his goals. So it planted those seeds of hope, and that's when I became involved with NAMI and their peer support groups.
And as we have this transparent and honest conversation about what so many people were understanding or dealing with in our community, we also want to make sure that we're providing resources and possible solutions. And you are a wealth of knowledge in that area. So tell us what resources are available.
So our community has wonderful resources. So let's start with NAMI, the National Alliance on Mental Illness, Miami-Dade, and the Keys. We have education and prevention. It is really important for parents, teachers, caregivers to know what are the warning signs. How do you talk to someone who you think may be going through a mental health challenge? Where do you get the resources? And how do you advocate and navigate the system of resources? So I put that in sort of a prevention education bucket. We have support groups for families like Cindy and Dennis Murphy. The support groups help families cope with the terror of a loved one being seriously ill, help families understand how to best talk and engage their loved ones to maximize the potential of recovery.
Yeah.
And helps their own coping and knowledge, and it's very, very essential. So NAMI has peer and family support groups. In Florida, we have a managing entity system. Cindy mentioned that they don't have insurance. That's not a barrier to mental health care in Florida.
Well, that's good to hear, because a lot of people feel that, boy, I can't afford the care.
No.
And I think we should point out too that this path can start with a simple phone call to 988, and we're going to get more information about that as well.
Absolutely.
If you dial 988, that's basically a clearinghouse. You can get from there to NAMI or other resources.
Right, or you can call NAMI's warm line if it's not a crisis, but you want information.
Thank you both so much for coming on today and being transparent and sharing your stories. You know that you're changing so many lives by being here today.
Thank you for shedding light and providing these resources for the community. It's very, very needed.
Yeah, no, as Nadja said, thank you.